The conventional wisdom in medicine is that women don't need testosterone. I think that's wrong. Testosterone is important. And the decline in testosterone is part of why women become more and more subject to breast cancer as they get older. There was a study back in 2001 that terrified everybody about hormone replacement therapy. But from 330 all the way down to 50 cases per 100,000 for women who were consistent in their testosterone supplementation. That's pretty dramatic. Hello again. I'm Dr. Jerry Mixon, and this is one of a couple of short videos that I'll be doing on women and testosterone. Now, the conventional wisdom in medicine is that women don't need testosterone. I think that's wrong. In fact, in our clinic, virtually every woman is on testosterone supplementation. Of course, our patients tend to be mostly mid-40s and up. But by their mid-40s, most women have lost most of their testosterone. And something most doctors don't seem to recognize is that testosterone is actually a woman's primary steroid/sex hormone. A young woman, 18, 20 years old, has got 2.5 to 3 times more testosterone in her system than estrogen. Now, I've gone through this in detail in a previous video, so feel free to go back and look at the other videos. But that is the reality. Estrogen is not the primary female hormone. Testosterone is. Estrogen is important for keeping women softer, rounder, and of course for their reproductive capacity. It also alters the way their brains are structured, etc., compared to we men. But testosterone is important. And the decline in testosterone is part of why women become more and more subject to breast cancer as they get older. Again, there is a video specifically on breast cancer and how to avoid it. So I will strongly suggest you go back and look at that video too. But that one's going to show you that as estrogen, progesterone, and testosterone all decline, the risk of breast cancer rises. There's a doctor in Ohio, Dr. Glazer, and Rebecca Glazer is a brilliant woman. In fact, if my wife ever gets breast cancer, I'm sending her to Dr. Glazer. That's my number one call. She's done some great research on women with breast cancer and combination of surgical and testosterone interventions. But let's kind of go through some numbers here. Liars use numbers, but numbers don't lie. So let's take a look at the numbers. First, the Women's Health Initiative. That was a study back in 2001 that terrified everybody about hormone replacement therapy. In that study, the women in the active group got both conjugated equine estrogens, that is estrogens from the urine of pregnant horses, and Provera, a medroxyprogesterone acetate, which is a synthetic progestogen, not real progesterone. And those women had an increased risk of breast cancer, about 27%. But they later went back, looked at that study again, and looked at the women that got estrogen without the synthetic progestogen and found that the women who got estrogen alone actually lowered their risk of breast cancer about 30%, cut the risk of heart attacks by 40%, cut the risk of colon cancer by 40%, decreased the risk of osteoporosis, and improved their life, had less mortality overall than women who didn't get estrogen. So estrogen is a great thing to give people. But now we come to testosterone. Estrogen is important. We know that now. But what about testosterone? Well, if testosterone is the primary sex hormone that women have, why are we afraid to use it and put it back not at male levels, but at healthy female levels? Well, Dr. Glazer has done that very thing. and she's looked at the incidence of breast cancer. In fact, she's looked at the incidence of all of the age-related, menopause-related symptoms and how they're impacted with testosterone, and we'll get to that in the next video, I think. But in the Women's Health Initiative study, the one I just referred to, that study had a control group. These were women that were in their 40s, 50s, 60s, 70s, and they were not given any hormones. They were the non-hormone users. And the breast cancer risk in that population of non-hormone users was 330 cases per 100,000 woman years. So 330 cases. Let's use that as our baseline for women who did not get any hormone intervention. Okay. Then the next study is the SEER study. Now the SEER study looks at cancers and a whole lot of different interventions, but this looked at the general population. So some women got estrogen, some women took birth control pills that were estrogen-based, some women had no hormones at all. And when you get that mix of estrogen and non-estrogen users in the broad American population, well, the breast cancer risk is lower. It's 223 cases per 100,000. So women that we know got no estrogen, 330 cases per 100,000. Women who have a mix, some with, some without, 223. So it looks like that population that got some hormones did better. Fine. There was a group, Donovits and Cotton, who published a study in which they looked at breast cancer incidence in women who did get some testosterone supplementation. Testosterone supplementation in their study was relatively short term. It was, I think, about 3 years or so, but it reduced the risk of breast cancer to 144 cases per 100,000. So it cut it by more than half. You went from 330 with non-hormone users, 223 with some hormone users, pretty much uncontrolled, just reflecting the general population, 144 in women who got testosterone for a relatively short period, about 3 years. So then Dr. Glazer came in and looked at women that she put implants in. Now these were testosterone implants, so she put them under the skin. Each implant would last 3 to 6 months, but it meant that they would be relatively stable in their testosterone usage, except for the women who didn't come back to get an implant. Well, they found that women who used their implants some of the time, but not all of the time, their risk was pretty close to the Donovits and Cotton study, 150 cases per 100,000 women. But the women who got their implants consistently, never went off the implants in this 10-year study, their risk of breast cancer was 50 per 100,000. Now, you got that right, 50. From 330 for the people who got no hormones, a 30% reduction for women who got estrogen alone, but from 330 all the way down to 50 cases per 100,000 for women who were consistent in their testosterone supplementation. That's pretty dramatic. You start to see why at Longevity Medical Clinic, all of our midlife women effectively are on testosterone. My wife is on testosterone. I plan to keep her on it for basically forever. We've been married 19 years, and she's been on it for 19 years. And I don't want her to get breast cancer. So reducing it to 50. Now we also do other things for my spouse, and these are things I think you should do too. First, you should exercise. Physical exercise lowers the risk of breast cancer. Exercise triggers the production of myokines. These are products produced by working muscle. Every time your muscle contracts, and the more muscles you've got and the more frequently and intensely they contract, the more myokines you produce. And the myokines alter your immune response to make you better at finding and killing cancer cells of all kinds, including breast cancer. So the women who exercise at least 3 hours a week and do so vigorously lower their risk of breast cancer by another 21%. The other thing is to get lean. Fat causes breast cancer. We now know that for every 11 pounds of body fat you add, you increase your risk of breast cancer by 7%. So go back to your teen years when you were at your leanest, take that weight. If you are 11 pounds heavier than you were in your teen years, you've increased your risk of breast cancer by 7%. If you are 22 pounds heavier, you've raised it by 14%. If you are the average midlife American woman and you're about 44, 45 pounds heavier than your teen years, you've raised your risk of breast cancer by 28%. Take the fat off, okay, and exercise vigorously, but you should also be on testosterone supplementation. That cuts that risk from 330 per 100,000 to 50 per 100,000. We're going to talk about testosterone and menopause here in our next video. Thank you for watching so far, and I hope you keep watching us here at Longevity Medical Clinic and Leading Edge Medicine.